Colonoscopy. Many have heard of it and maybe even dread it. But is the procedure really worth the anxiety? Let's be direct. For those who get one, the risk of dying from colorectal cancer can be cut in half, a 50% reduction. That's because its main target, colorectal cancer, often develops with zero symptoms in its early stages. The threat is also growing in younger people, prompting the recommended screening age to drop from 50 to 45. In the next few minutes, we'll bust the biggest myths and show you why this procedure is more advanced than you think. How does a colonoscopy achieve such a dramatic drop in cancer deaths? The secret is prevention, not just detection. During the procedure, doctors hunt for polyps, small growths that can become cancer, and they remove them on the spot. Finding a polyp does not mean you have cancer. Most are benign. Removing them is simply weeding a garden before a problem grows. This sounds fine in theory, but we have to address the elephant in the room, the fear of the prep, the pain, the results. So let's confront these fears directly. Is the procedure truly as bad as its reputation? Let's bust 3 myths right now. Myth 1, it's painful. Reality, with modern sedation, most patients feel little to nothing and often don't even remember it. Myth 2, the prep is unbearable. Reality, the old giant jug of chalky liquid is being replaced by low-volume solutions and even pills. Myth 3, it's dangerous. Reality, it's a very safe procedure. Serious complications happen in fewer than 3 out of every 1,000 cases. Beyond just being safe, the technology itself has become incredibly advanced. This is why it is called the gold standard. Doctors are no longer just relying on the human eye. Modern scopes use high-definition cameras and special light filters. The biggest update? Artificial intelligence. AI systems now work with doctors in real time, acting like a second pair of expert eyes. And this isn't science fiction. Studies show AI assistance increases polyp detection by up to 40%, preventing future cancers. This technology is impressive. But what about the simpler at-home stool tests? Are they a good enough substitute? Stool tests like FIT are non-invasive and convenient. They are a good screening tool and certainly better than no screening at all. But they have a key limitation. They mainly detect blood, a sign of larger polyps or existing cancer, not the smallest growths. And if a stool test comes back positive, the next step is always a colonoscopy. Only this procedure can both see and treat. So we've established it's the gold standard, but even that isn't foolproof. So what makes the difference between a good and a great one? The first factor is something you control, the quality of your bowel prep. If the colon isn't clean, polyps can hide. The second factor is the skill of the person performing the procedure, something most patients never think to ask about. Gastroenterologists are measured by a metric called the adenoma detection rate, or ADR, the percent of patients they find a polyp in. A higher ADR means the doctor is more thorough. For every 1% increase in ADR, your risk of a future cancer drops by 3%. You can ask about this. So let's connect these pieces. What does the ideal, life-saving colonoscopy actually look like in practice? First, you acknowledge a silent disease needs to be found before it becomes a problem. This is why we screen asymptomatic people. Second, you combine a perfectly clean colon from a good prep with a highly skilled doctor who has a proven high ADR. Finally, you augment that doctor's skill with AI that catches what the eye might miss. Prep, doctor, and tech. That's the combination. And while it seems like a big procedure, the long-term math is clear. Prevention costs far less than treating advanced cancer. So, is a colonoscopy worth it? If you are over 45, have a family history, or have symptoms, the evidence is overwhelming. The fear and myths are real, but they are based on an outdated picture of the procedure. Knowledge is the best antidote to anxiety. Revisit that first statistic, a 50% reduction in cancer deaths. That is more birthdays, more holidays, more time with loved ones. Don't let myths or anxiety make one of the most important health decisions for you. Talk to your doctor and schedule your screening.